Hello. This video for NU 621 Advanced Pathophysiology, Week 6, will be about rheumatoid arthritis. These are the references that were used to compile the information in the video. These are public domain and easily accessible, and I chose to do the quiz again. There's lots of information, and if you have any questions, hopefully these sources or sources that you find for yourself will answer those questions. First question: which of the following is the most common area affected by rheumatoid arthritis? 1. Temporomandibular joints. 2. Metatarsophalangeal joints. 3. Proximal interphalangeal joints. Or 4. Metacarpal phalangeal joints. Do you remember your anatomy? Number 4. Metacarpal phalangeal joints. Rheumatoid arthritis is a chronic systemic inflammatory disease. It's actually an autoimmune reaction which causes synovial hypertrophy and chronic joint inflammation. There are some theories that the cause is thus and such, but there is no definitive known reason why there is an autoimmune reaction setting up this chronic inflammatory response. It generally affects the small joints of the hands and feet, but any joint that is lined with synovial membrane can be affected. It causes chronic synovitis, and early treatment is the key for reducing morbidity with this disease. Which of the following is not associated with a poor prognosis in patients with rheumatoid arthritis? 1. Female sex. 2. Age older than 30. 3. Extra-articular manifestations. Or 4. High serum titer of autoantibodies, such as rheumatoid factor and other protein antibodies. Not associated. Age older than 30. There is a poor prognosis if the disease occurs in those younger than 30 years of age. Certain genotypes, certain autoantibodies that are present, manifestations other than in the small joints of the hands and feet. If there's a large number of joints involved, that will portend a poor prognosis. Female sex, systemic symptoms, insidious onset. So there's a lot to watch for and consider when doing a risk factor profile. The next question: which of the following organ systems is more likely to be directly affected by rheumatoid arthritis? Urinary system, digestive system, cardiovascular system, the lymphatic system. And the answer is 3, cardiovascular system. I'm sure you're wondering why this is, and if you think about the explanatory features, I think it will make sense. Most of the information regarding morbidity and mortality have come from patients who are being cared for in specialty units in hospitals. We don't have much information longitudinally about those individuals just out in the community, living with their disease, working, just carrying on their normal lives. They're not as easily studied as those in the specialty units. But what they know is the leading cause of death in patients with rheumatoid arthritis is cardiovascular disease. And I'm sure this is not surprising to you at all, seeing as how cardiovascular disease is a leading cause of death in most of the world, and specifically in the United States. And if you think about the pathophysiology involved, you've got improvement in mortality when the inflammation is controlled. So there are several theories that suggest, and there are some research studies that have shown that there is an inflammatory component to the coronary artery disease and to the formation of plaque and for several other cardiovascular symptoms. So if you reduce the inflammation, then it goes to correlation that you would reduce the risk for developing coronary artery disease and cardiovascular disease. So it does all tie in together, but there's not a wealth of information that is evidence-based at this point. Which of the following is the first choice for imaging in rheumatoid arthritis? 1. CT scanning, 2. MRI, 3. Ultrasound, or 4. Radiography, or X-rays. The answer is number 4, radiography. An X-ray is inexpensive. It's easily available in just about all the healthcare facilities that someone would be at. It provides easy to follow disease progression so that you can watch year to year, or when there are changes you can see what they were before, what they are now. MRI is the definitive test to order, but that usually comes later on. And in clinical practice, the insurance companies will push you to do the X-ray first, and they base their recommendations on evidence-based medicine also, and what's in the research. Which of the following is the drug of first choice for patients with rheumatoid arthritis? Rituximab, etanercept, infliximab, or methotrexate? The answer is methotrexate. There are recommendations for pharmacologic treatment as well as non-pharmacologic treatment. And non-pharmacologic treatments include exercise, diet, massage, counseling, stress reduction, physical therapy, and sometimes surgery to realign the joints. Also, it's good to have participation of the patient and family in planning and designing the treatment plan and what step will be done when and who will be involved. There are non-biologic and biologic disease-modifying anti-rheumatic drugs, or the DMARDs, which are well covered in your pathophysiology text. NSAIDs are used, usually ibuprofen or Aleve, analgesics, and then steroids, especially for flares. Thank you for your time. If you have any questions, there's a lot of good information in your pathophysiology text. The references that I provided at the beginning of the video, as well as other things that you may be familiar with and have used in the past. Again, I want to make sure that you always reference the most current guidelines and stay current. Call me if you have any questions. Thank you.